Very good evening to all of you. I welcome you all to this excellent webinar. Well, out of the 21 committees, we are the Young Ophthalmologists Group of Maharashtra. This is the first of the webinars where we have one of the most talented teachers that we have in India and around the world, who is going to give an insight on a new subject, that is e-learning in ophthalmology. Well, he does not require any introduction, but a short resume is definitely going to, is my duty to do that. Well, Dr. Santosh Honover is passed out from RP Center and Wills Eye Hospital, Philadelphia. He was trained, established ocular oncology at LVPI. He was the associate director of the LVPI and he established the residency program. He currently heads oculoplasty and oncology for Center for Sight and also for the CFS education. He was awarded the Shanti Swarup Bhatnagar Award by the Government of India, Jerry Shields Award by the Asia Pacific Academy of Ophthalmology, and is the first Indian to receive a Lifetime Achievement Award by the American Academy of Ophthalmology in 2019, and an honorary fellowship of Royal College of Ophthalmology UK in 2020. And he is the chief editor of the Indian Journal of Ophthalmology, a very good friend of mine, a very humble person. But as I just said, you ask him anything, is like an encyclopedia. So I would now request Dr. Santosh Honover to take over and give us an insight of e-learning in ophthalmology. Over to you, Dr. Santosh Bose.
I thank Maharashtra Ophthalmological Society and the Young Ophthalmologists Committee and Dr. Taswala for this, Rajesh, of course, Rajesh Joshi and Sumit for this wonderful opportunity. I'll share my screen. I was asked to speak on internet resources for ophthalmologists. Especially in the times of COVID, learning and training have become very difficult, and internet resources are the ones which are actually letting us keep pace with the training and teaching requirements. So we have realized that learning and training have become severely impacted, especially during the second wave because of lockdown and disruption of access. Deferred elective procedures in most of the medical colleges and institutes, cataract surgery, glaucoma surgery was stopped for a while, and sometimes in some institutes for several weeks and months. Conversion of ophthalmic facilities to COVID care centers, drafting of residents and faculty for COVID care, rescheduled virtual examinations, fellowships were disrupted. So all these caused a lot of disruption. What is famously said is that he who studies medicine without books sails an uncharted sea, but he who studies medicine without patients does not go to the sea at all. Well, that was William Osler long ago, but times have changed. And actually, the virtual training has become a reality. You can actually learn a lot without even touching a patient or seeing a patient. Well, that is not an ideal situation, but given the contingency of the current times, we have to have a backup of virtual learning and training. Learning is an individual effort. Everybody has to make efforts to learn, and learning can occur anywhere at any time, in the sense that learning is not dependent on teaching. Of course, learning is to a certain extent dependent on teaching, but beyond teaching, formal conventional teaching, you can continue to learn 24/7, and that is what is virtual learning. In training, it is participatory in the sense that there has to be a trainee and a trainer. But the trainer currently can be physically with you or be virtually with you. That is again a reality of virtual training. Training is received at a specific place and time. Like now I'm talking to all of you, that is fixed. But then beyond this, if this particular lecture is recorded and put on a media platform, you can still learn from it, but I'm not present at that time. So virtual training is a possibility in current times. So learning what an individual does, training is something they receive, and both are possible. So learning and training can continue uninterrupted in current times. There are several components of training where knowledge is the core component, and self-centered or student-centered learning can continue beyond classrooms. So what are the possible options? We have a lot of options, one of which is internet resource. So internet has become inseparable from our lives for everything, right from buying a book to buying grocery to managing your bank account or stocks, everything is completely dependent on internet. It provides seamless a sea of knowledge. There is no barrier at all, but it's a double-edged sword because when you type something on Google, what comes out is something that is non-curated or non-moderated content. Everything that is there online comes out. So if somebody has put in garbage, garbage will come out. So unless you have some kind of a gateway where you access knowledge based on the reputation of the source or the credibility of the source, then you're not sure what is the knowledge that you're getting. Most of our patients who type in their disease on Google get wrong information. That is because everything that is out there comes out. So finally, what is important is a good source. Good knowledge is necessarily equal to what is emanating from good source. So we really need a well-moderated, reviewed source, preferably run by an organization of repute when you talk about internet resources. Now, what are the resources that we have? We have what is called random information pulled up by a general search. Even as an ophthalmologist, sometimes you type keywords on Google and get information. That is absolutely random. There is a 50% chance that you might be encountering wrong information or partially true information. We have individual run educational portals. That means individual practitioners or ophthalmologists run educational portals, which are good. There are organizations, societies, and institutions which run education portals for online training specifically, which is also good. There are other organized internet-based resources, journal websites, etc., which are extremely good, and specialized search in the form of PubMed. And of course, there are ebooks. So these are the 6 types of internet resources, typical types of internet resources that we can think of. Ekalavya, his name starts with E, was the first e-learner because Dronacharya was far away and he learned by not by direct contact but by observation, isn't it? So e-learning portals are a reality, and in fact Shankanetralaya e-learning portal was named Ekalavya. It's no longer working, but that's a very innovative term, I would say. Now, what are the things that you can learn by internet resources? One is diagnostic and clinical skills. Suppose you're a first-year resident and you don't know how to do refraction. Well, one option is to do it on your friends, but who would want to get dilated? Right? Your friends may not want to get dilated. Or go on to patients and start learning. But the patients are very smart. They pick up a novice ophthalmologist or somebody who's doing refraction for the first time very easily, and they may not cooperate with you. So before you even go to the patient, if you want to know how exactly would the glow look like, what would be the point of neutralization, then you go on to certain simulators, Retinoscopy Simulator. Earlier, it was hosted on iontext.com. Now it is part of American Academy of Ophthalmology. In fact, if you save this lecture, you get the URLs right here. You can type in the same URL. It's on the AAO website. It is called Retinoscopy Simulator, where for a patient, if you can put different powers, minus and plus, and neutralize, you can actually know how a glow would look closer to neutralization. This is a clip from the video. You can see that power can be added and you can achieve neutralization, and how exactly would the glow look closer to the point of neutralization is what you would learn. So even before you go to the patient, you exactly know how a glow is likely to appear. And if you don't know how to elicit relative afferent pupillary defect, then there is a simulator as well. No RAPD, mild RAPD, moderate RAPD, severe RAPD, you can actually know how it would look like even if before you go to a patient. So there are simulators for refraction, there are simulators for relative afferent pupillary defect. Similarly, there are simulators for squint. In this website, ao.org/interactive, there are many simulators. One is for basic squint evaluation, and the second is for even advanced squint evaluation. These are free to access sites. You can log in and start evaluating squint and learning. It also has glaucoma algorithms for angle closure glaucoma, normal tension glaucoma, and primary open angle glaucoma. Now, for gonioscopy, if you're interested in gonioscopy, you can go to gonioscopy.org, which is a website specifically meant for gonioscopy. It shows you what are the normal angle structures, what are the abnormal angle structures, demonstrates every single technique of gonioscopy. So even before you go to patient, you know exactly what gonioscopy would look like. This is some of the videos that are there demonstrating 4-mirror videos and different types of gonioscopes that are there, and the normal and abnormal angle anatomy.
Sussman lenses and similar lenses.
Extremely good resource, explains the lenses, explains the terminologies, explains the anatomy, and shows you what is normal and abnormal. Now, another source for basic learning or even comprehensive learning of ophthalmology for a resident or a fellow or a practitioner is called iWiki. It's like the Wikipedia for ophthalmologists. This is again currently run by the American Academy of Ophthalmology. This has all the subspecialties, and for example, if you go to subspecialty of cornea and external disease, you can see almost all the entities that you can ever come across in this subspecialty are listed alphabetically. So you can click on any of these. Similarly for glaucoma, retina, oculoplasty, neuro-ophthalmology, every entity that you can think of, including ocular B injuries, is listed, and you can click on any of it and get advanced information. How does it look when you click on it? For example, I have clicked on, say, allergic conjunctivitis. So I get a list of contents, each of which is hyperlinked to a detailed content. So example, epidemiology of allergic conjunctivitis, risk factors for allergic conjunctivitis. So this is one-stop shop for all the information that you want to gain in ophthalmology. And this is curated information run by American Academy of Ophthalmology. So it has reputation. It is editable, but not freely editable as Wikipedia. Here you have to log in and establish an account for you to start editing it. So as an ophthalmologist, if you want to contribute to iWiki, you can edit what is already available, but your name will be associated with it. So authenticity is always checked. There is somebody who's called a moderator who will curate what you have edited, and finally it will be posted. One more important information about iWiki is that it runs competition for residents. Suppose your resident or a fellow wants to write up on a topic which is already not there on iWiki. They have a competition every year. The best of iWiki articles win a free trip to American Academy of Ophthalmology, including registration. So that's a very good thing your residents can start doing, or you can start doing yourself if you're young enough. Write an article on iWiki following the standard format, and it will not only get published, you'll also have a chance to win awards. The next resource I have is called Atlas of Ophthalmology, atlasofophthalmology.net, that is the URL. This is a collaborative atlas made with the efforts of these 4 individuals. Anybody can contribute images to Atlas of Ophthalmology, and it is freely downloadable. Suppose you have a seminar or a symposium that is coming up. You simply go on to the Atlas of Ophthalmology, click on these links, go to conjunctiva. It opens up all the conjunctival entities and photographs. You can download it. Of course, it is always a good idea to acknowledge the source and use it freely in your lecture without any copyright infringement. The next website is by universities. University of Utah has what is called Moran Core. Moran is the name of their eye institute. Core is for Clinical Ophthalmology Resource for Education. Moran Core is a very robust educational website run by Moran Eye Center of University of Utah, where there are a lot of sections and contents: basic ophthalmology, optics, ophthalmic pathology, neuro-ophthalmology, pediatric ophthalmology, strabismus, everything that you can think of. All these are filtered by subspecialty, and they also have grand rounds. Grand rounds are mainly by residents and fellows, resident lectures, surgery videos, and student and resident knowledge base or knowledge content. So you have subsections as well. And they also have their live grand rounds. You can actually attend their live or recorded grand rounds every week. And you can see that they have curated grand rounds right from 2013 onwards. So if you imagine, if you're a resident in a medical college where you don't have much exposure to large number of cases presented in a very formal way, if you go through these grand rounds, suppose there are 50 grand rounds every year, you can have say 500 cases seen over a period of say 8 or 9, 10 years. That will complete your ophthalmology curriculum. So it's a very good source. There are many sources like this. This is just one example which I'm giving. If you are interested in this particular website, it is absolutely free of charge. The next one is called irounds.org. Irounds.org is again a very popular American website. You can see there are case reports, tutorials, atlas, and videos that are part of it. This is run by University of Iowa, which is very reputed to run educational programs. Now, when you go into submenus of irounds.org, you find that there are morning rounds recordings, which are every week. So there is a huge amount of curated content which is archived over a period of time. There are faculty lectures and also videos from iRounds which are classified into different subspecialties. Now, Columbia University has their own website that is called Digital Reference of Ophthalmology. This is the URL down below. You can in the recorded version of this talk, you can actually copy and type this URL for access, or even go to Google and get this very easily. University of Michigan Kellogg Eye Center also has a website called the Eyes Have It. You can again see subspecialties in ophthalmology or different conditions that are listed here are the menus, each one of which will open up submenus. And for example, if you just go to their systemic conditions and click on congenital rubella syndrome, first thing that shows up is a picture. And then there are sub questions. What is it? How does it happen? What else looks like it? And what do you do? These are simple questions which are clinically relevant. If you click on it, the answer will appear, pop up. And this is a very simple way of learning off the cuff. Those were the university websites which are famous or curated university websites. Now, putting it all together is a website that is called a master website, you can call it, an overarching website called iguru.org, which is a collaboration of UCLA, Doheny, Arvind, Wilsai, and Mass Eye India. So this is mainly for high yield content, and that is for what is called OCAP, which is an American version of resident evaluation program, which all the residents take every year. So this is for mainly meant for OCAP preparation, but it gives you enough knowledge. Now, one more organizational website is cybersite.org by Orbis International. Orbis is a flying ophthalmic hospital which lands in different countries and different cities and conducts educational programs. This is actually a global community where they have lectures, surgical videos, quizzes, textbooks, and manuals on various topics of ophthalmology. That's the library out there. You can easily access all this free of charge. And for example, here, if you click on pediatric ophthalmology and strabismus, there are 7 lectures, fundamentals of ROP, strabismus, retinoblastoma, neuro-ophthalmology, etc. So this is a very authentic website. And they also have monthly or periodic webinars, and you can get the upcoming webinar schedule on the website. And for cornea and external diseases, you can see lectures on dry eye, quiz on red eye, quiz on chronic conjunctivitis, surgery on conjunctival inclusion cyst removal. All that is there on the Cybersite website. You also have what is called iCube, which is a UK website, and most of the content is geared towards FRC ophthalmology, FRCS preparation, but no exam-oriented preparation is immune to general learning. So obviously you'll learn a lot of general ophthalmology and specialized ophthalmology by going through the contents of this website. And one more source for if you are looking at ICO and MRCS, FRCS, Edinburgh, Glasgow, and FRC Ophthalmology. This is Muthuswami's virtual university for ophthalmologists. This is mainly aimed at preparing candidates for courses for ICO exams and for Royal College of Ophthalmology's exam preparation website. If you are very keen on subspecialty learning, you've finished your general ophthalmology learning, now you are a fellow or you're an ophthalmologist in your own right, and if you want to further learn a particular aspect of ophthalmology, such as neuro-ophthalmology, then Novel, run by again UTA, is a website, Neuro-Ophthalmology Virtual Education Library, which has content ranging from several decades. Actually, it's a very rich content in neuro-ophthalmology, lectures of several decades, even including individual collection of mentors and very popular lectures in neuro-ophthalmology. If you're a buff for ophthalmic pathology, then David Kogan Ophthalmic Pathology Collection is out there. It's called Kogan Collection, where if you have any confusion about the ophthalmic slide, ophthalmic pathology slide that you're looking at, if you're an ophthalmic pathologist, or if you're an ophthalmologist, if you want to learn a little bit about ophthalmic pathology, it has a collection of entire set of common ophthalmic and even uncommon ophthalmic diseases. And you can zoom into the slides and look at the content and also look at the explanation. If you are a retina kind of a fan, then you have Image Bank of ASRS, which is beautiful images. And these are self-explanatory images. Images are so beautiful, so good. The quality of images, in fact, this is contributed, and most of the images are by very good sources, and even Indian ophthalmologists of repute have contributed to this image bank. This is very nice. In AIOS also, there are virtual learning opportunities. We have IGO and IGO case report, now IGO videos as well. AIOS proceedings, which is run by AIOS, again has all the contents of all the past conferences, which are archived. You can go to any of the conferences which you have attended or not attended and listen to any of the instruction courses or lectures or even free papers. Arup has done a wonderful job by running this. Chitra is running the ARC website, and AIOS webinars are run by the Secretariat. There is a AIOS discussion forum, case of the month, etc. This is the IGO website, which provides all the journals of IGO right from its inception. All the 70 prior volumes of IGO right from the first year are available on this website. So every IGO that is published ever is available free of charge. This is the archives. You can go to 2021, you can go to 1960 and still get all the articles that were published at that time. IGO case reports is a separate website where all the case report issues that have been generated so far, 5 of them, are all archived. The current one is IGO videos, which is just started this month. This is the first video or Journal of Ophthalmology, which is already on PubMed. This is indexed from the first issue onwards because this is part of main IGO. It has a home in YouTube and you can access IGO videos on it. Coming to the most important of ophthalmology resources, that is American Academy of Ophthalmology, ONE network. Hub is currently down, but it may be up very soon after updation. But I'm going to concentrate on ONE network because this, I believe, is the most important learning resource for an ophthalmologist trainee or a consultant. Now, the beauty of ONE network is that it provides you all the important journals. Now, you have no excuse to say that my library does not have this journal. It is too expensive to subscribe. Well, you know, journals are stolen from the library. This particular issue is missing. You have absolutely no excuse. Anybody can access who is a member of AIOS. All you need to do is to be a member of All India Ophthalmological Society, and ONE comes to you by default. You don't have to be a member of American Academy of Ophthalmology. You can see all the major journals are part of this particular library and they are free to access. Apart from journals, you can see the rich educational content, basic and clinical science series, courses. You have Femto Center, you have journals, you have media library, You have everything that is possible in ophthalmology, hundreds of videos, hundreds of lectures, quizzes. You can have nice lectures, master classes, everything classified and curated by subspecialty. Journals I already showed, videos, and something which is very important, self-assessment or quiz that you can take yourself, and at the end of the quiz, you'll get your valuation. What I considered most important is preferred practice pattern, right from conjunctivitis to, say, neovascular glaucoma. There is preferred practice pattern that is available on the ONE network. Preferred practice is nothing but evidence-based recommendation as to how you would diagnose and manage a particular disease, however common or uncommon it may be. So preferred practice, when it is followed, generally gives you the best of outcome, and there is evidence to what you have done or what you're doing, so that nobody can question you as to the authenticity of your management protocol or the authenticity of your diagnosis. So in your preferred practice pattern, you have, as I said, everything that is common: blepharitis, bacterial keratitis, cataract in an adult eye, conjunctivitis. Everything that is common has a preferred practice pattern. This particular aspect is currently missing, but it may be available soon. This I used to use when I was running the residency program at LVPI. This is called the Residence Hub, where you can manage the entire residency program online. This was slightly ahead of time, I would say 10 years ago, but currently its value is immense. If you have such a program where you can assign lectures to residents, evaluate them, and also track as to how much of the content that you have assigned to them has actually been read and for what duration, that is going to be of immense value. Here, AO has its own content, but apart from that, you can, as a faculty, you can add more lectures to the content, and all this is available to all the residents for them to access and pre-study before they even come to your lecture or even come to the grand round. And there is an assessment which can be performed online. Another major website is by the International Council of Ophthalmology, ICO. ICO has split into two. The original ICO also has what is called ICO portal now, which is a very nice and updated portal, where you have ICO member society symposia. So all the member countries of International Council of Ophthalmology, all their symposia are available. These are small icons on which if you click, you can see part of the AIS icon here. You have access to their symposia. And very nice development, very recent development is that all the ICO member society journals are available. Links are available on the ICO website. You can have everything, including Canadian Journal of Ophthalmology, ASRS, IGO, you can see here, second in here, even ophthalmology, ophthalmic plastic and reconstructive surgery. All the journals of all the member societies of IGO are available. Now, iplanetcom is something which is closer to home, which is run by Sun Pharma. This has all the contents. And we have iFocus currently online. We have run about 176 lectures already, all of which is available on YouTube. All the lectures are for 45 minutes to 50 minutes duration, followed by 10 to 12 minute discussion. And you can see 6,50,572 views to date. That means so many people have accessed these lectures all over the world, I would say, with 11,700 members. So the reach is immense if you have good online content. Shankar Netrala used to run a website called ekalavya.org, which I told you earlier about, which is currently not working so robustly, but Auroshiksha is working. Auroshiksha is by Arvind Eye Care System, where there are lectures for mainly for ophthalmic training, ophthalmic assistant training series, anatomy, physiology of the eye, etc. And also, this is the LVPI teaching program, where they have education meets excellence as the goal, where webcasting of grand rounds used to happen. Currently, I'm not sure whether it's happening. They have Just a Minute and other pearls as well. Coming to individual resources, anybody can access what is there on Facebook. Many ophthalmologists put their videos on Facebook. There are Facebook groups called I2 India or I2I India, or many such Facebook groups where there are ophthalmologists who post their content, which is slightly informal. But individual websites are, some of them important ones are eophtha.com, which is run by an ophthalmologist, and it has very good content for exam going ophthalmologists. You can see the list of topics here. It also has past question papers, collection of lectures. iLearn is a recently developed website by two ophthalmologists, where they have had location to include all the DNB question bank, DNB OSCEs, topic-wise university question banks, DOS times compilations. All these are very useful for a resident. This is one-stop shop for a resident currently, ilearn.org. And one more resident developed website or a fellow developed website is iToday. These are all Indian ophthalmology learning resources developed by Indian ophthalmologists. This is Ophthalmobytes, which is also a very nice, recently developed website by an Indian ophthalmologist who is currently doing a fellowship. This is called RPC Rounds, which is developed by an RP Center resident, which has nice content mainly for use by residents. This is timroot.com, developed by individual Dr. Tim Root, who has a lot of lectures and animations on basics of ophthalmology. Apart from these websites, we have what is called podcasts. Last week, in fact, a podcast was recorded on resident training.
Yes.
Yeah, so podcasts are non-video based content. Basically, this is oral content or sound-based content. And podcasts are becoming popular because you can listen to them on the go. If you're just sitting and doing nothing and you want to rest your eyes and simply exercise your ears, you can put on the headphone and listen to podcasts. So how do you access podcasts? If you have an Android phone, you can download the app, Google Podcast. Apple has its own podcast app, or you can go to generic, which is non-platform based, platform agnostic apps such as Spotify, etc. There are any number of podcast apps, and if you look for the contents, you will get ophthalmology related podcasts easily. But if you really want to go to specific podcasts, then as seen from here is a series of podcasts which is run on an Apple model. You can see Apple Podcast app can actually pull this up for you, which is extremely good. But there are some highly specialized topics such as retinal transplantation, etc. Ophthalmology Off the Grid is a podcast series on iTube. iTube is an analogous of YouTube run by AO. You can see if you type on ophthalmology podcasts on Google, you can see the spectrum of podcasts that are available. Even Maharashtra Ophthalmological Society has a podcast series that is coming up, which is very nice. So basically, podcasts are something that are light on the eyes, or almost zero on the eyes. It doesn't take your visual attention, but it only takes your oral and brain attention. These are heard in leisure. You can stop anytime and hear it over and over again. Something that is very formal and evolving is snippets run by Shankanetralaya, which is a kind of group discussion centered on a faculty. Residents sit around a faculty and then they discuss. This is nice. I've heard a couple of it, accommodative isotropia. It's very, very nicely covered. Snippets is closer to home. Well, if you're a fond of apps, then apart from the podcast apps, we have these following apps which are popular. My Eye Anatomy, iTube, iGrader is an app which is nice because all the grading in ophthalmology, everything right from grading of cataract to diabetic retinopathy is all on one app. Ophtho questions and AO educational content is also available in the form of an app. Going on to surgical skills. How do you develop your surgical skills based on internet resources? Well, we're all very fond of YouTube, but how many of you have heard of iTube? I'm not sure. iTube is an analogous of YouTube specifically for ophthalmologists. This is partly run by the American Academy of Ophthalmology on the URL itube.net. This is beautiful. Look at the quality of this video. This is a trabeculectomy that is being demonstrated with commentary. Look at the quality. How clear is the video? And is there anything that is left to see beyond this? I'm not sure. Of course, individuals have their own YouTube channels. There's a Cataract Coach YouTube channel and also a website run by Dr. Uday Devgan, where you can submit videos even anonymously and get comments by Dr. Devgan. And you have the Arvind Eye Care System YouTube channel, where the YouTube channels of the Pondicherry, this is run by the Pondicherry branch of Arvind, are all listed there. And we have cataract surgery simulators on internet. It was earlier run by a website called Naritas. Now, this was a cataract master website designed by Mass Eye and Ear Infirmary. This was earlier on a private website. Now it is on AO and it is free of charge. How does it work? Well, for each cataract surgical step, it breaks it down into small defined steps, and it gives you instruction as to how exactly to do it. And when you do it, if you falter, you can go back and look at the original video which is associated with that particular step, learn it, and come back to the simulation. I'll just show you a small video. See, make a paracentesis incision with a blade parallel to iris stroma. That is all. So that's one step. So similarly, there are hundreds of steps. Each cataract surgery step can be broken down into small sub-steps, each of which has a description. And see, it shows exactly select an action. So if you select an action, make a paracentesis incision with blade pointed perpendicularly to cornea, it shows exactly how to do that with an explanation. Make paracentesis incision with a blade parallel to the corneal stroma, it shows you exactly how to do that. This is just about a paracentesis incision step, but similarly, every step has been explained in such minute detail on this simulator, which is accessible. Now, there is a website called Simulated Ocular Surgery, where there is remote simulation, supervisor-based simulation also possible, but you have to register for it. But already recorded content is available for everything that you can think of in simulation-based surgery, even using ping pong balls and other vegetables for simulating surgery. The way it is to be done has been described. Rectus muscle insertions, scleral suturing techniques, how to do capsular access, all these are available on this website. So simulation in residential education is coming up in a big way because of COVID times and loss of contact with patients. And AOORG has a resident simulation module. And these are the modules that are currently available, mainly centered on cataract surgery, but strabismus and retina are not far off. Essentials of setting up a wet lab for ophthalmic surgical training during COVID pandemic was written up in IGO, and you can actually set up a wet lab for training your residents and mentor them in a remote fashion connected on internet. Now, as far as publications are concerned, what are the e-learning resources? The most important, of course, there are MBAs and other sources, but PubMed is free of charge and it is very popular and very easy to access, intuitive. But you should know how to type on PubMed. What are the keywords that you have to type on PubMed to get the best of results? So when you go to PubMed search itself is a lecture. So I don't have time to go through it in detail, but when you enter PubMed, once you register yourself, there is something called a PubMed tutorial. If you go through the PubMed tutorial, it will teach you exactly how to optimize your search in PubMed using what is called Boolean logic, where you can put in a particular set of keywords in a particular way to get the results of your choice. Instead of getting 500 or 600 articles, you can narrow it down to 30 or 40 most important articles by using what is called logic. So basically you have to click on these boxes and get what is most relevant to you and use the correct logic. About presentation and teaching tools, we have so many learning teaching tools now for online conferencing and webinars, etc. Right now we are using Zoom, but you can do the same on Skype, Microsoft Teams, Google Meet. Many of these, in fact, there are platforms called Thinkific, Teachable, Udemy, VizIQ, lot of it. And for teaching residents, we have apps again. This is called Socrative, where there are two modules, one for the learner and one for the teacher. There are two modules, as I said, each of which can be downloaded and students can be asked questions, online quiz can be taken, online assessment can be taken in the sitting of a classroom or even remotely. Everything is possible. So in summary, I would say that internet resources are unlimited and boundless. And but we should limit to time-tested and reliable sources of information rather than random searching, because information management is like having your mouth to a fire hose, and you should obviously not have this kind of a situation. You should have very nice curated content which you can drink. So learning and training in COVID times, you have to embrace the new normal, where physical learning sometimes becomes very difficult. Learning should continue uninterrupted despite the compulsions of COVID. Several essential components of training do not need patient contact, and these need to be fully exploited by using e-learning. You should build small learning teams and group learn. In fact, it's a good idea for 6 or 7 residents to get together, each of them, of course, maintaining physical distance and wearing a mask, getting together and then listening to a particular online lecture and then discussing on that in the presence of or without a faculty mentor. And you could also be part of bigger learning teams that have a wide overview, such as iFocus, and always follow the AIS ophthalmology curriculum, which is online, so that you kind of complete the entire curriculum over a period of time. This is the national curriculum for ophthalmology residency training, which all the residents, if they follow, this will be extremely good for you to kind of structure your learning. So in conclusion, I would say that learn to navigate the ocean of knowledge in ophthalmology in COVID times. Be fully prepared to deep dive into patient-centered learning and training as soon as the situation eases. But currently, of course, you should stay wise and stay safe. Thank you so much.
Fantastic, Dr. Santosh. The very exhaustive and absolutely to the point. What all you have covered, I think is not only going to benefit the residents, but fellow ophthalmologists also across all strata. We have two of our young ophthalmologists, one is Dr. Sumit Lahane and of course Dr. Kulkarni. Amay has joined, Sumit?
Sir, he could not join because he has an internet issue presently. So
okay. So no issues. You take over and have the question and answers with our faculty, Dr. Santosh. Whatever we have on the audience, this thing, Facebook or YouTube, and do a question answer session. A wealth of knowledge he has got. So let's have maximum more. Thanks a lot. Yeah.
Thank you, sir. Thank you, Santosh sir, for your time and such a nice lecture. And it should be basically a beginning of e-learning. There are so many sources that you enumerated, and of course, it becomes sometimes difficult to pick up from all of this. So you have covered almost everything. There are a few particular questions that I want to ask. Like in the end, you showed there are certain surgical sites also for the surgical skill development. Nowadays, there are surgical simulators which are available, which are made by the various companies, no financial interest, like Help Me See and everyone. So basically, there is a trainer and they do it as a surgery. And I have seen that those people who have trained in that, they of course get a little better hang of the surgery. So what is your thoughts about it? That should it be one of the part and parcel of a residency training program at all India level? Or we should just do it where it is like you said, it's scarcity of patients and everything.
I think it's always a good idea, because as somebody was pointing out, no pilot is allowed to fly unless he has undergone simulation. So simulation is very good because it gives you a lot of coordination and pre-knowledge before it prepares you for surgical training. So it's always a good idea to prepare residents on wet lab and simulation before they go to patients, irrespective of the fact whether they have patient volume, load or not. So it is a part of modern day learning. In fact, that's how sequence is, that you go to wet lab first, simulators, and then go to your actual patient. If you follow that route, I think every resident will be much better trained and will have concept of how to use a particular instrument, how to hold it, and how to respect tissues.
So another question on the similar lines. It's a practical thing that we all face. That every PG who joins is basically concerned about learning a cataract surgery during residency. Nowadays, the residency program is equivalent to a cataract surgery learning, and that is their primary aim. And they miss other subspecialties, and there are a lot of resources. And basically, as they prioritize cataract surgery learning much more than the other knowledge and the medical knowledge of the surgery. So since you have seen a lot of postgraduates and trained many fellows, so what is your message for them, and how do you basically want to tell them? Like I keep on telling them that more than the number of surgery, the technique of surgery for any surgery is more important, because observation teaches you much more before you actually do it. So what is your message for all those people who are joining the residency or still are at presently in the residency?
I think you're absolutely right. I think comprehensive ophthalmology is the base of the pyramid that gives you the, kind of a foundation for the entire ophthalmology. In fact, if you look at the, if you talk to experienced practitioners in any tier 2, tier 3 city, or even in major cities, what kind of cases do they see in the OPD? Out of 100 cases that they see in any given OPD, about 70 to 80% are comprehensive ophthalmology. Unless you are a super specialist and you practice only super specialty and don't give appointments to anybody else, you will have a load of comprehensive ophthalmology as a background to your cataract practice or cornea practice or any practice for that matter. So it's a great thing to be a very good comprehensive ophthalmologist, so that you don't have to refer most of your patients out and you can treat them at the point of entry itself. Second is that unless you learn the entire spectrum of ophthalmology and not just restrict yourself to cataract, then you'll not be able to take care of all the patients that walk in. If you don't learn the basics of trabeculectomy or entropion, ectropion, you'll end up referring those patients out, or you may end up suboptimally treating them. So comprehensive ophthalmology background, I feel, is extremely important before you venture onto cataract surgery. And it is the number of cases are generally not so important. A critical number is there, of course, so that you have a good hand-eye coordination and you start respecting the tissues well, you know the technique. But most important is to learn the technique the correct way, and numbers will come later.
Sir, you showed a lot of resources, and you yourself running many of the out of that, including IGO case reports, high focus lectures, and those are very helpful. But what do you think is one part that we can upgrade in the e-learning, like interactive e-learning or something that is still not done in the e-learning? What is your thoughts about it? So what could be the next line of vision in the e-sources than what is available presently?
Well, flipped classroom is a very good way of e-learning. Flipped classroom is when, generally what happens is when a class is taken or a lecture is taken for residents or fellows, residents and fellows don't come prepared. It's the faculty who come prepared and teach the residents. So you are sowing seeds in a dry soil, which is not actually kind of prepared for the seeds that they're going to receive. In a flipped classroom, what happens is that you give them all the preparatory materials in advance. So they are expected to read a particular set of material or listen to a particular set of lectures before they come to the class. And the class is mainly based on discussion. So that means that the seed is already sown, it is watered, the ground is prepared, and you're kind of arrived you have arrived to the class to reap harvest out of what you already sown. So that is something that can be done even on internet. So if you assign, suppose there is a mentor to say 10 or 20 residents, he can assign them learning material for, say, suppose you are giving a lecture on entropion. You assign the anatomy of the upper lid and lower lid to them. You assign videos of entropion surgery to them. You assign classification of entropion from a textbook or chapter on entropion from a textbook to them. And when they come prepared, you just have to do an overview of entropion and then start discussing. Let them ask you questions or you ask them questions, and there can be a bilateral discussion, all on an e-learning platform. That is something that can happen.
That's a really nice idea, sir. And sir, as you said, there is an article also published, and a lot of discussion keeps going on the ideal residency program. And you have managed one in LVP, and you have been in constant touch with postgraduates on even on individual basis. So if we ask you that what could be ideal residency, in the sense if you want to divide in a subspecialty way, those 3 years, how optimum use of efficient use of those 3 years can be made according to you?
I think the first 3 or 4 months should be spent in gaining knowledge of history taking, basic examination, comprehensive examination of a patient on slit lamp using all these slit lamp accessories and eliciting findings. So clinical evaluation and clinical examination techniques should be learned in the first 3 to 6 months, apart from knowledge of gaining knowledge of anatomy, physiology, and biochemistry. That is generally followed by microsurgery training, wet lab, and simulation. And the first cataract surgery should probably happen at the end of 9 to 12 months. And that will go on parallelly. Meanwhile, they should start rotating in subspecialties if there are subspecialty units in medical colleges, which is an ideal situation. But if not, at least rotation in different subspecialties in places like RP Center and RIOs where there are subspecialties. Resident rotates through all the subspecialties for about 3 months each. So for example, in cornea, they're there for 3 months. If there are 2 cornea units, they're there for 6 months in cornea. Similarly, retina, glaucoma, oculoplasty, squint neuro-ophthalmology. So they get an overview of the entire ophthalmology.
And sir, in final year, basically, what should be the focus of students in that last year or the last 6 months? Like, because that is the time when they are going to leave the institute after 6 months after the exam. Last 2-3 months go into the dissertation and their study preparation. And after that, they will be individual post-MS, post-DNB treating some patient somewhere with or without supervision. So how those last 6 months should be planned for the students?
Last 6 months should be planned to make them independent. That means they can run OPDs on their own with supervision. They can do surgeries on their own with supervisions. That will give them the confidence that is required to start off as individual practitioners if they start practicing just after MS or MD. But if they're aiming at fellowships, again, that becomes a totally different issue. That means they're going to become super specialized and not too much of comprehensive ophthalmology.
Sir, one question out of the box and out of the curriculum of this thing. Like we do see that they are doing residency, and many times what happens, it's again a practical problem that we face, that most of them have made up their mind that they are going to go into fellowship. And because of that, many times we have seen that they don't focus on the comprehensive ophthalmology. Like somebody who has made up a mind that I want to do cornea, then they will not look after specialties like plasty and other things. They basically take a backseat. And another thing which they don't understand in this is getting oriented to the thing that after 3 or 5 years of their education, they are going to be some individual without umbrella in the basically whole of the forum. And we, all this 4 to 5 years, never train them to basically tell them what is practice management that is going to be required post fellowship to set up an individual practice, how much obstacles they are going to face, or what are the other options that they can have. But none of the programs, none of the forums, and none of the at education level that we tell them about this practice management. So should we include that in one of the part of a residency, at least as a small part of the residency, that we must tell them that how to do this practice management later? At least they should be initiated about this. What are your thoughts about it?
I think that is most important. Otherwise, it will just be futile, because many of them don't even ask around. They gain experience on their own, try to gain, sometimes make mistake and learn from it. Career development, I think, should be part and parcel of every curriculum.
Sir, and there are like ICO forum, there are a lot of international exams. International Council of Ophthalmology conduct there are 3-step exam, and they had their association affiliation with FRCS. So, and since in this whole 3 years, the DNB does have exam, but MS curriculum doesn't have any in between exams. So we do motivate students, tell them that they should give certain exams, because exam is something when they actually study. So what are your thoughts about this ICU exam? It should be given, or is it a way of motivation? How should we look at it? How should we motivate students for the same?
I think it is a way of structured learning. Because it makes a disciplined way of learning, because they know that there is an exam, there's a refraction module, whatever. So they kind of tend to prepare for it in a very organized way. And if they fail, there is a loss of money, because it's a exam which has a high fee, and also a lot of reputation among their peers. So they are very competitive when they take the ICO exams. It gives them an additional degree, MRCS, immediately. They qualify for final FRCS. So it adds value to them. So it's no harm encouraging them to take these exams, provided there is no financial burden on their families, because it's a highly expensive exam.
Yes, sir. Sir, done asking these questions, but I would like to ask 2 personal questions, if you allow. Sir, one of this is we know all about your residency, and you won even the Rangachari Award in early days of your ophthalmology, which is a difficult task even for a very experienced ophthalmologist presently. So, if I ask you that, what is one thing that you think that you missed in your residency, or you would like to change about your residency? What is that one thing, sir?
Well, I think my residency was ideal, complete. I don't think I missed anything in my residency. Maybe career development, maybe financial management. That is something that was missing, because we are totally focused on academics. Epicenter is a life-changing experience. It's a big thing doing residency in Epicenter. It teaches you almost everything except maybe financial management and career management, because at the end of senior residency, I was very confused, because I hadn't even thought about what to do after senior residency. So in the last 3 months, we had to scramble around and see what to do. So that is possibly something that I missed.
And one last question from my side, sir. What was your motivation to join Ophthal as a postgraduate, sir, after your residency? Because we all know now that the patient drives you and the teaching drives you. But what was in the early days that you joined ophthalmology as your career option?
Well, I mean, I was slightly confused. I wanted a surgical specialty, but our MBBS ophthalmology mentors were extremely good. And we had Regional Institute of Ophthalmology where we had rotation during internship, and that was already subspecialized. And the teachers were great, especially the current director, Dr. Chandrasekhar Shetty, was the one whose notes I still have. He had such excellent teaching skills. And so I think that is one of the factors. Generally, you go by what is very attractive in your medical college to decide on what subspecialty would you do as a postgraduate. And I think in Bangalore Medical College, ophthalmology was very attractive.
Rajesh sir, Jignesh sir, any questions?
Yeah. Thanks, Sumit. You have been doing excellent moderation. You asked very good and up to the mark, of course, a little out of the box, but people are going to definitely benefit out of it. Few questions from me. One is about the simulation that you said. One is the online simulation, and what we have, what help me see people do it. Are they both at par, or of course, seeing the physical part, of course, people have to go there and spend time. So they miss the clinic. totally. How do you say about the online? How less it is, or how is it at par?
It is not at par, but they are complementary to each other. They're not supplementary. Why I
Okay.
say online is good is because it breaks down the surgery into small, minute steps. There's a theory to each of these steps, how to hold the instrument, and then there is an animation to each of these steps, which will tell you exactly how to use that instrument. And then there is a backup video which shows how the surgeon is actually using that instrument. So with these three critical inputs, one is theory background, which is an instruction. You have to do it this way. That is the instruction. There is no second option to that instruction.
Okay.
Second is an animation which shows you how to exactly hold the instrument. Third is a practical situation where the surgeon is actually using that instrument, following all the rules. Putting it all together, I think it makes a very good teaching tool. When you practice that elsewhere, if you remember those steps, these are called, actually this has been translated into an evaluation module also by ICO. This is called a rubric. Rubric is a step of a surgery that is broken down into multiple steps. And the assessment is already known to the student or the surgeon. The rubric actually mentions if a particular surgeon does it this way, he is considered good. If he's not done it in this way and does it in this way, is considered fair or scoring from 4 to 0, whatever. So if the student already knows that if he does this step in this way, he's going to be scored excellent or 4 out of 4. So that is the way kind of you break down the assessment also based on this kind of learning. So learning is very stepwise, especially for cataract surgery. It's been worked out very well, these online simulators, not for other surgeries, of course.
So you recommend first online simulator and then they should go and do it. That is how it is going to supplement.
Ideally, the module should be that if they're learning, say, for example, wound construction in a wet lab and on a simulator, they should do an online simulation on wound construction. Then they should go to a simulator and then they should go to the wet lab, all probably on the same day. So at the end of the day, they would be nearly sure as to how to construct a wound if they're given a patient the next morning.
Okay. Regarding your eye focus that you have done, the CFS education, how different is it from the academic that has been taught in the colleges, and how have you structured it?
It is not different. So what we have done is we have this AIOS curriculum. In fact, I consider AIOS curriculum as the ideal curriculum because it is a summation of all the major university curriculum, ICO curriculum, and the ACGME, that is American curriculum. It has components of European curriculum also because ICU curriculum was based on European curriculum, many of the European curriculum. So it is an extremely good curriculum where everything that is possible or necessary to learn in ophthalmology is included. Now, what iFocus does is takes the entire curriculum and plugs in resource material to each of the topics that are covered in the curriculum. So at the end of it, my goal is to finally, after having all these lectures, we have had 176 already just in, say, cornea. We have finished cornea, retina, and neuro-ophthalmology. Retina is half done, already 176 hours of viewing. So by the time we finish ophthalmology, possibly we'll have about 450 lectures. So each of these will be hyperlinked to the curriculum, and they click on the curriculum, these lectures pop up. So the entire resource material will be available. And the next step, of course, is to have lecture notes for each of these lectures, which I will push the faculty to do at least in the next round, so that we have lecture notes also available. So these are very leisurely lectures taken by the experts in that field who are well prepared for that lecture, 45 minutes to 50 minutes, no hurry at all, followed by questions by the residents and also by the panelists. So it kind of finishes that topic for that day.
Fantastic. What about the sites that you have said? If a comprehensive ophthalmologist wants to go at one particular, which is the one you would recommend for a comprehensive? Yeah.
Yeah, for a comprehensive ophthalmologist, I would recommend IWiki for theoretical knowledge and AAO One Network for theoretical and practical knowledge. And for closer to home, AIOS Proceedings has all the conference proceedings. So even if you don't attend the AIOS conference, you can learn everything that happened in AIOS conferences. So if somebody attends all the instruction courses of AIOS Proceedings, that will also be very good.
Fantastic. Yeah, as I just started as an intro, you're a walking, talking encyclopedia of ophthalmology and e-learning. Very nicely covered. Rajesh,
Dr.
your questions. Your
Yeah,
questions.
yeah. Given a choice for a particular topic, what Dr. Santosh would like to refer to? Learning resource on internet or a book?
Currently, there is no one answer for this. Books, I used to tell Sumit also when he was a fellow with me that it takes about 10 years for new knowledge to get into books. But that is fine. Books are slightly dated as far as new knowledge is concerned. But if that knowledge becomes obsolete, it doesn't come out of the book, it stays in the book. Some of the books don't have a new edition. So even 20 years after the knowledge is gone out of vogue, books still carry it and residents quote it, practitioners quote it. So books are static sources of knowledge. And the value of books, that is the reason why the value of printed books has come down. Value not in terms of financial value, the learning value has come down drastically because advancement of knowledge is happening at a very fast pace now. The amount of knowledge that is getting accumulated by year in this particular last 20-30 years that I've seen of ophthalmology is much higher than what had happened in the past 200-300 years. So the pace of development is books are not able to keep up with. That's why e-learning is editable, modifiable on a daily, hourly, minute-wise basis. So that is why it gets. So what I have told you today, what I have lectured, content may totally change after a month because new information may come up, right? So that way, I feel there is a combination. Books, but basics never change. Books are very good for basics, but to add a second level to it, I think internet resources are very important.
Surgical website for the fellows and the residents, which one would you recommend out of all? Suppose exam going and they just want to go through the steps and all.
iTube is very good.
Achha, iTube is good. So any more questions? Any Sumit, Rajesh? I've just limited it because with Santosh around, people will just bombard questions otherwise. We wanted a very specific topic for him and he's covered it fantastically. And Sumit, you have moderated the sessions, he has answered it. The interactive session also has been very, very good. And I'm sure we'd like to have more of you, Dr. Santosh, on other topics for the young ophthalmologists. I'll be coming up to you for the newer topics, the way you teach, the way you conduct things and the way you put across the knowledge is absolutely commendable. We are really thoroughly enjoying it also and learning also. So now for the vote of thanks, anything you'd like to say, a go message for the students and the residents and the fellows and the fellow ophthalmologists before we sign off?
Nothing really. I think the brightest of brains come into medicine and the brightest of brains come into ophthalmology. Ophthalmology is a specialty highly in demand. So at the end of it, the product should also be good. So if they invest a little more on their residency training and fellowship training, I think their own quality will be improved and they'll have much of value addition. That is what I would say. It's for wasting time during residency because we study so much in MBBS. 99% of what we study in MBBS is hardly ever used. We finally come to ophthalmology and that is what we are going to practice. So I think we have to give our best to our specialty, which we are specializing in, ophthalmology and whatever subspecialty that they do in fellowship.
Very nice. Rajesh, over to you for vote of thanks.
Yeah.
We are now,
in fact, that was wonderful, sir. Master stroke by a master. Your talk was very informative to everyone, I suppose, not only young one, but every age group. You elaborated on so many learning websites. Think of the topic and it's available everywhere. On behalf of MOS, I thank you from the bottom of my heart for making us aware of so many resources. I thank Sumit for nicely conducting the session. And of course, Dr. Taswala for his great initiative. And all the listeners of the today's web meeting. Thank you and good night to everyone.
And the Entod people also
Entod
for
people
the technical backup that they have given. Fantastic. We'd like to have a gallery view photograph. Everybody put your video on and let's have for posterity a photograph. Mr. Janardhan, please. Ashwin, if you're there, a quick photograph. Mr. Janardhan, are you there?
Yes, sir, I'm there. I'm taking your picture, sir.
Yeah.
Done, sir.
Yeah, thanks.
Thank you.
Can you put the recording off now and let us know the audience number on the YouTube and this Facebook?
Yes.
And put off the recording. We are just off the record. We'd like to have a little gupshup with our faculty. Yeah. Santosh, what is the best time now next month you would like to spare? Mondays are okay or any day 9 p.m. is fine with you?
Monday, I think, is a busy day for most of the people. Saturday would be better, I suppose.
Okay, Saturday is fine.
Yeah.
So I'll plan it accordingly.